We have a very specific question for Dr. Gadiri, who I would like to answer this in an accurate but diplomatic way. So the question is, a doctor at the International Behcet conference last month in Morocco, that some of us had the pleasure of attending, said that if a patient has snowballs as part of their intermediate uveitis, they don't have Behcet's and need to look for another diagnosis. Well, this person who sent it in has Behcet's and has had snowballs, which must be a technical term for something in the eye. I'm sure it's not really snowballs in the eye. They've had snowballs in their eye for years. Could you comment on that, Dr. Gadiri, please?
To go back to my talk, the disparity in views even amongst uveitis specialists in populations which see a lot of Behcet's uveitis is still huge. I would disagree with that. I think it's a controversial statement to say snowballs you don't see in Behcet's, because I've seen all kinds of manifestations of Behcet's uveitis in my career. As I mentioned, there are more classic features of Behcet's uveitis, but snowballs being just a representation of a certain type of inflammation that we see in a certain anatomical part of the eye, their presence can't be used to rule out Behcet's uveitis. So I think it's healthy to have debate, and sometimes sometimes being controversial can generate. Is this diplomatic enough for you? Stimulate thought at least, but I personally disagree with that. Discuss that with your doctor. I think I value when my patient comes to me and says, "Have you thought about this?" And if I don't know something, or if I'm questioning my own previous beliefs, then that's healthy in medicine.
Great, thank you. So you've heard it straight from the horse's mouth. That's very good. And we have to be careful as doctors to be very careful about not being too black and white and dogmatic about things, which, as you can imagine, with a unusual condition like Behcet's, sometimes the answer is a little greyer. So thank you very much, Nima, for clarifying that.